All right, we're rolling. We're here to go. All right. Well, thank you very much for the introduction. I'm Chen, as you mentioned, and I'm a resident in radiation oncology at UCSF. And it is my great pleasure to be presenting an initiative by the ROECSG Patient Education Working Group. And thank you for many of you guys who helped complete a survey to help inform the results of this study. So patient education is a big area of interest because understanding of radiation therapy by many patients and their family members is often limited. Many patients don't know about the logistics, the side effects, and the outcomes of treatments, and often harbor fears or misconceptions about what radiation therapy might entail. This lack of understanding can contribute to anxiety for patients and their family members and may impact their quality of life and their willingness to receive radiation therapy. Overall, we have limited data on optimal approaches to patient education within our field. This has inspired us to wonder, how can we deliver inclusive, accessible, and patient-centered education to our patients who receive radiation therapy? We had a threefold approach to try to assess this. First, we hope to assess the current practices and preferences for delivering patient education among interprofessional radiation oncology providers. Next, we wanted to identify barriers to developing and implementing patient education. And third, to synthesize key strategies for successful patient education delivery to help inform recommendations for individuals and institutions. To do this, we developed a 17-item anonymous survey, which was developed by the ROECSG Patient Education Working Group. We distributed this survey via Qualtrics to all ROECSG members between October and November of last year. And some of the data collected included demographics, provider practices and preferences, and also institutional practices. We used descriptive statistics, Fisher's exact tests, and thematic analysis to look at survey responses, the practices according to education timing, as well as qualitative responses for open-ended questions. There were 123 people that completed the survey for a response rate of 31%, and we had representation from a variety of different backgrounds. This included attendings, most often 64%, which was followed by trainees at 21%. We had 7% who were medical physicists, and some representation from physician assistants or nurses, radiation therapists, and other types of educators. For the practice setting, 87% of those who responded are affiliated with an academic center or university. About 13% were in community practice or private practice, and about 82% were practicing in North America. In terms of the educational approaches, the source of the most common patient education resources used were those that were custom created by each institution. So that was about 61%. About 38% reported that they used materials that were generated through the electronic medical record system. And a number of people, 41%, reported that they tailored their practices depending on the type of clinical encounter. So for in-person visits, most used paper handouts, and for virtual visits, many used videos or multimedia. If we look here on the left-hand side, we have a figure that's depicting the different educational techniques that were used across time. So in blue, we have at the pre-consultation time point, red is consultation, green is simulation, and then purple is during the radiation treatment. And this represents the educational practices of just those who have MDs, so radiation oncologists, and also trainees. And we can see that pre-consultation, about 70% are not doing any type of education at this time point. At the time of simulation and during radiation treatment, about 40% are also not giving any patient education at these time points. Most of the patient education is concentrated in during the consultation time point, and one-on-one teaching is the most frequent method used at 89%, followed by paper handouts and written materials via the electronic medical record system. Some more innovative approaches, including what we were hearing about in just our last presentation with videos. Those were slightly less frequently used: organizational websites, virtual reality, and group classes. They were also just in the single-digit usage at the time point of consultation and throughout this continuum. Oh, wonderful. Our next slide is here. For educational materials, about 86% reported that their institution utilized site-specific patient education materials, with the most common ones being for breast and head and neck. There were about 80% of institutions that had materials for these. And about 58% reported that their institution had non-English materials available, with Spanish being the most prevalent. I think overall this illustrates that there is some diversity in terms of the disease sites and also languages represented, but certainly some seem to be either more well-resourced, or there's more gung-ho physicians within those disease sites who are championing the development of patient education materials. For review of educational materials, we can see on the figure on the left-hand side that about 40% were either unsure of or reported that there was no assessment of these materials. Among those that did have assessment, the most common was the review by staff at about 50%. And in terms of assessment frequency, which we can see on the right-hand side here, almost 50% were also unsure of the assessment frequency. So the materials that are being put out there, I think there's also a lot of room for improvement for figuring out, are these materials of good quality? How can we better improve upon them? And that's an opportunity for future. On qualitative responses, there were several challenges that were identified by the respondents. So limited time was one of them. There was limited time both for providers to develop these materials and share them with patients, as well as for patients and their family members to have time to review these materials. There was also identified inadequate administrative support, which manifested in terms of lack of prioritization for development of these materials by leadership, lack of training on how to deliver patient education effectively, as well as insufficient funding for developing these education materials. Lack of customized resources was another key area that was highlighted as both a challenge and an opportunity, with patients with different educational backgrounds, cultural backgrounds, language, disease sites, and other patient-specific characteristics. There were several strategies that were identified as successful for giving patient education, and I was inspired and blown away by many of these responses on how best to customize opportunities for patient education. One of these include incorporating visuals and other multimedia resources. I think especially during the COVID-19 pandemic, when a lot of visits did turn virtual, there was a lot of space for innovation in this area, in this regard, to try to help connect with patients in different innovative ways. Personalization of content and delivery for patients and caregivers based on their learning styles, their preferences, and language is also a key opportunity. Repeating information multiple times by different members of the interprofessional team was also highlighted as very important. I know a lot of us in the room, ROECSG is a very diverse community, not just physicians, but also radiation therapists, dosimetrists, physicists, a whole range of gamuts, and many people have opportunities for FaceTime with patients at different time points. So incorporating our nurses, our radiation therapists, opportunities to reinforce information, I think is really helpful for making it stick for patients. And then finally, utilizing active education like teach back method, where patients are encouraged to repeat back what they've recently learned, or encouraging note taking or involving caregivers, or also other strategies. In conclusion, interprofessional radiation oncology providers engage in patient education, and most do utilize institution-specific materials. Patient education practices may differ according to the type of clinical encounter and also the timing in the radiation care path. The adoption of multimedia materials and partnerships with patients and organizational leadership are needed to tailor the patient education resources and to foster high-quality patient-centered education delivery. I'd like to thank everyone who responded to the survey for all of their insightful comments, to thank the ROECSG Patient Education Working Group, as well as the great mentorship from Drs. Jennifer Croak and also Anna Brown for leading our wonderful patient education group. Thanks so much, and I'm happy to answer your questions.